Hello everybody, it's Suhail Mirza and welcome to this very special episode of Voices of Care coming from the heart of Westminster. Policymakers, politicians are gathering to look at the report from the Social Care Foundation calling for urgent and radical reform of the social care sector.
Frankly, social care can't wait till 2028.
The overwhelming consensus is, first of all, you need more money.
We are sleepwalking into both a humanitarian and an economic disaster if we don't grasp this.
The current government is acting quite slowly on social care.
It boils down to the fact you just cannot fix all the issues with the NHS without addressing social care.
We need to think about this in much more long-term processes than the usual 5-year parliamentary cycles.
There's been a lot of controversy about the way the CQC has regulated the sector.
The councils auction off care to the lowest bidder and people have to like it or lump it.
What we suggest instead is a national care system so that it's simpler all round. The money is distributed nationally.
For years we've been calling for cross-party talks on social care because we need a long-term plan that won't change as governments change.
So effectively, it will give everyone the freedoms that only those who are self-paying at the moment get.
Voices of Care, the healthcare podcast.
Great to see you this morning, Robert, here in Westminster again, and quite a year for the Social Care Foundation. You're the founder, and we've got a report asking for radical and urgent reform.
Yes, I'm delighted that we have got here safely despite tube strikes and everything else. The reason that I set up the Social Care Foundation, it's perhaps a good idea to mention why did I set this up. I have a long history in social care. I got into it by accident, but I have a long history in it, hence the lack of hair, I suppose. But it was really the COVID pandemic. I mean, I've always been proud of our biggest asset in the social care sector, which is our amazing staff. But it was really during the COVID pandemic that I've never been so proud both of our frontline heroes in social care, but also to be in this sector. And so I promised myself coming out of that sector, once I got my feet back under the table from a business point of view and stable footing for Renaissance Care, that I would do something to move and encourage meaningful reform going forward. And because the amazing staff that look after our vulnerable members of society 24/7 really deserve better, in my view, support and help from all of us, the public and government. And so that's really what inspired me to set up the Social Care Foundation, and very fortunate that I was able to persuade Damien Green to become chairman and together we appointed an advisory council
Of the great and good
of
in social care, if
I
I may
wasn't
say
going to
so.
mention the great and the good, but certainly of several luminaries. It's very much a cross-party thing. That's absolutely key as well. One of the things that we talked about at our first advisory council meeting with Damien as chairman and the new advisory council members was, let's put a report together to come out in the autumn, i.e. now, and we've been working on it all summer, to be a sounding board for Baroness Casey as she begins, as she has started, I believe, in a cross-party meeting she's had recently. And so that's really the background of where we've got to as far as today. About why it's needed is something that you might want to ask.
No, absolutely. I mean, there's 35 recommendations. We can't go through them all. We're
No.
going to be speaking to Damien. There's a couple that really stand out for me. And one of them was the call for regulation and commissioning to work together. You're very expressly saying that the CQC needs to do the job properly to support providers and actually to end commissioning on price alone?
Well, definitely. I mean, it should be on the basis of need, but also the key. Well, in my view, the key one for me, there's a number, but the key one for me, I mean, NHS. We must have an end to NHS first and social care second, and
Yep.
we can't have social care as a Cinderella service any longer. And the NHS and social care are two sides of the same coin, and that you cannot fix the NHS. I mean, it's not just my opinion, it's a fact. You cannot fix the NHS without first fixing social care. I mean, it's not rocket science. I mean, this is basic common sense. I mean, the social care, which is much larger in size than the NHS, if it collapses, then what happens to our beloved NHS? And why I mention all that is that the key one for me is the taking away from local authorities.
Yeah, the funding, the distribution
The
of funding. Yeah.
So that there's real, meaningful, joined up writing, which is the best chance we've got of ending this budget fight between NHS and local authority, and where you and I as a taxpayer are left footing the bill for people beyond their clinical needs, staying in hospital at 4 times the cost of them being in a care package, either at home or in a care home. So that, to me, because that will, in my view, and Damien's view too, is greatly reduce bed blocking, which will reduce cancelled operations and will reduce NHS waiting lists. So that's a key one. I'd like an elderly care commissioner. I was keen on that. And yes, having a 10-year workforce plan, a 10-year technology plan, and reform to apprenticeship levy. There's, as you say, there are 35. But I think the key thing too is we didn't want it to be a shouty report.
Yep.
We
You said that you actually want to engage constructively with any political party that's ambitious enough to engage with you.
We wanted it to be positive, constructive, and yes, thought-provoking, and radical, yes, but not shouty. And I think Damien's done a masterful job, and I'm very thankful to him and proud of the support that myself, Dawn Park, my chief of staff, and several members of the advisor council have helped. This is Damien's report, and he's done an amazing job over the summer and done all the heavy lifting. And he's had help and support from a number of us getting to this glorious day today where we can announce it. And we want it to become part of the debate. We're not shouting at Baroness Casey. We're trying to engage with her in a constructive and positive manner. And we did invite her to come today, but obviously not expecting her to be here. But we will send her a copy of the report, and I look forward to the debate heightening going forward, because frankly, social care can't wait till 2028.
Absolutely.
It is a fact. It's in intensive care, and 2028 will not be 2028 because there'll be a general election. So we're talking about 2030, probably 31. So we're in 2025 just now. So we're talking about 5-6 years before action is taken. And I think there's quite a lot of low-hanging fruit. And yes, the spectre of the Treasury will be over the shoulder of the Casey Commission. But I do think that there's a lot of low-hanging fruit that shouldn't frighten the Treasury, that can be actioned now, next year, 2026, 2027, and that doesn't need to wait till 2028. And I think that's involving to because when you speak to Treasury and you talk about more money, you see their eyes glazing over. But actually, a key thing that we're trying to get across is a lot of what we're proposing is making more efficient, better use of taxpayers' money in the overall NHS social care budget. I mean, it's what we in the independent private sector have to do day in, day out. And so why not government?
Absolutely. Now, one final thing just to wrap up, because we're going to have Damien here to talk about that report, of course. You're a very celebrated business person, an icon in social care, if I may say so. One of the themes that struck me from the report recommendations was centered around multi-year commissioning and the role of government and regulation to support stability, to allow investment and lower access to lower cost of capital is so important. And you make that.
No, that's a good point. And in the report about the British Business Bank, because the problem is care homes, the cost of building care homes is so large, and actually has had quite a spike post-COVID, building costs, etc. And I really think that something like the government using the British Business Bank's services to provide long-term, low-cost finance to care home operators to build care homes in the places where they are needed, not just where private funders are predominant. It's where, and actually, where they're needed is also where it's easier to get staff. So it's a win-win. And in return, care home operators would need to, say, make 75% of the beds in those care homes available for local authority residents. So that's one of the key, in my mind, one of the key recommendations of the, as you say, 35. But then Care Connect hubs, My Care portal to make a one-stop shop for the public, because people always say to me when they need to look at care for an elderly relative, they say to me, it's just a maze of information and different places you have to go. If only there was one place that you could go to and reliably get that had the government stamp of approval, and that you got the right information in the one place. So that's another one. I'm very excited about what Damien's done. I'm very appreciative of his Herculean efforts. But then putting aside his political career, he was a journalist for many years, and he's got that unique talent and ability to get concisely to the point. And I'm very proud of what he's achieved, and it's onwards and upwards for the Social Care Foundation. Excited about the future.
Well, we're delighted always to speak with you, Robert. I'm sure this won't be the last time that we'll speak to you on Voices of Care, and obviously we're wishing you all the best in engaging with politicians and policymakers. So thank you, and look forward to
Thank you for being here this morning and all your support.
It's a pleasure and an honor to spend time with you.
Okay.
Thank you.
Thank you.
Damien, welcome, and I should begin by saying congratulations on a very busy summer and the Social Care Foundation's report into the social care sector.
Thank you. Well, it's timely. I think that this week, Louise Casey has held the first cross-party meeting, so there's signs of life from the Casey Commission. So I'm glad we're putting our ideas out there now.
Well, we've had the privilege of your wisdom before on Voices of Care, and I remember very distinctly when we spoke some months ago that you were really calling for urgent reform. Otherwise, the system, to quote you, before the system potentially goes pop. There's 35 recommendations. We can't talk about all of them, but I wanted to start with the F word and begin there with funding. And you've said there are a number of things that can change, but there's no getting away from the fact that the system needs more money.
I think that's the basis of it. One or two people I spoke to say, "Oh no, you could do it with the existing budget," but I think
there must be alchemists.
Yeah, the overwhelming consensus is, first of all, you need more money. So the funding section we divide into two, because we say, I mean, essentially any government has got two choices. You can either raise it collectively through taxation, and if you want to do that, then revive the idea of the health and care levy so that it's a specific hypothecated extra national insurance payment to do it that way. Or You could do it through people's individual savings, either for people to save for a care supplement, so they know that they will have enough money in a pot to pay for whatever care they need, that they can either do long-term saving, as you do for other things, or quite often at the end of life, at the end of working life, people will have accumulated quite a lot of equity in their house or something like that, and a part of that could be used to buy an insurance policy. So that's half the funding issue of how you get some more.
Now, the other one that's really interesting for me is who controls the flow of the money, and that was the radical thing that really sprung out from the report. Local authorities should be taken out of the equation.
Yeah, I think, for their own sake as much as anything, that we know that local authorities are being overwhelmed by a number of pressures, of which social care is one. And so what we suggest instead is a national care system, so that it's simpler all round. The money is distributed nationally, and it's distributed on an individual basis, that you would have an assessment done, an objective assessment done of what your needs are, as they do in Australia. And from that would flow, okay, this specific sum of money, and that money you could then say, okay, I want to use this provider for either domiciliary care or residential care if necessary. So effectively, it will give everyone the freedoms that only those who are self-paying at the moment get. So, and I think it will be much simpler for people to navigate.
And to help them to do that, there's a couple of other proposals which I'm system-wise, I want to just very briefly touch upon. And there's a very clear call for a true integration with the NHS. You make reference to examples, Andy Burnham, etc., where it can't be just about window dressing. There's got to be real joined up health and social care.
Yeah, I think window dressing is a good description of what's happened up to now. We've had these integrated care boards, but they're not really integrated. So yes, we think that the commissioning system and the way the system is devised as well should be a joint effort between health and social care. That social care should have parity of esteem, and also that there should be visible representations of the fact that there is a national care system. So we say that, for instance, people looking for the first time online should have one portal to go to. We suggested My Care as a portal, so that will guide you. And actually, physically in the community, we want to see local care hubs, so that again there are human beings you can talk to who can say there are these voluntary services, there are these private services, there are these state services, NHS services available, so that you have a single point of contact, and that I think would just make life easier for everyone engaging with the care system for the first time.
Yeah, because it can be quite Byzantine trying to traverse it. I was also interested to see the call for, obviously, regulation to be more proactive. It's not quite the invisible hand of Adam Smith, but I think you say at some point the Casey Commission might want to look at a more assertive management of the sector to make it sustainable.
Yeah, there's been a lot of controversy about the way the CQC has regulated the sector, and the CQC is under new management, so I think there are hopeful signs there. But nevertheless, I think that one of the things that I'm struck a lot of people in the sector say is that basically they are regulated in a much more harsh way than the NHS is. You're allowed to fail for years on end in the NHS, and you're not, quite rightly, in the care sector. So if you're going to integrate the NHS and the care sector, then you've got to have better integration of the regulatory system as well.
Final point, if I may, looking to the future, the report isn't talking about the here and now. It looks very candidly about the possibilities of technological transformation. I'd like to just briefly touch upon that. And prevention, the idea that actually with advances in geriatric medicine, etc., there can be a reduction in need, because the numbers are quite stark. Over 65s, 13 million at the moment, going to 17 million in a decade or so. So this is an imperative.
Absolutely. I mean, they're both imperative. The use of technology, which people talk about AI in sort of fairly glib general terms, but have a look at what it can do. It can do diagnosis better and faster. than human beings. So there are various areas. It can, we are at the stage where in other countries they use robots for personal care, and people say in a way that's quite often better because you preserve your dignity if unpleasant things are being done by a robot rather than a human being. So there's a lot to be done on that actually for the provision of care. There's also the integration of patient records. The fact that care homes don't know what the medical records were and things like that is completely unacceptable in the modern era where information can flow immediately all around the world. And in terms of prevention, there's one of the other bodies I sat on was the Older People's Housing Task Force, which recommended a much greater provision of housing suitable for elderly, often frail people, so that they can live in their own homes for longer, which they want to do, which is much cheaper for everyone. It's an absolute win-win. We need to build a lot more of that. And also there's some interesting research being done over the past few years, particularly at Richmond University, showing that actually sort of keeping people wrapped in cotton wool as they get older and frailer is exactly the wrong thing to do. Get them out, get them active, make sure particularly they have friends that engage in a community. All of that helps their health as well. And that way you'll reduce the demand for care for any individual for maybe further into their life. And every 6 months you can do that is better for the individual, which is the main thing, but also, as it happens, better for either your individual purse or the public purse.
Well, I think no one can disagree, and given the terms of reference for the Casey Commission, that must come as a pleasant surprise, a win-win which doesn't actually cost extra money. Damien, always wonderful to talk to you, and thank you very much for giving us your time, and I'm sure it won't be the last time that you'll hopefully join us on Voices of Care.
I hope not. Thanks very much.
Thank you so much. Thank you. Danny, welcome to Voices of Care on this special day, publication of the Social Care Foundation report, and obviously the Liberal Democrats, we've been privileged to have Sir Davey on here. Social care is a drum that you as a party have been beating quite powerfully, actually, for quite a while.
Yes, I mean, it's one of our main issues, and it boils down to the fact that you just cannot fix all the issues with the NHS without addressing social care. So I'm the MP for Winchester. At any given point at Winchester Hospital, there's 180 people that would be better cared for at home with the social care package or in the community in some form, and yet there just aren't enough resources to give them that. And the crazy thing is that it costs more money to keep them in a hospital bed than it does to give them a social care package anyway. It's about £850 a night to keep someone in a hospital bed. So not only are we not providing the social care which would be better for those individuals in their recovery, it's actually, in the long run, costing the taxpayer a lot more.
And the report actually calls for quite a radical change to funding passing by local authorities following the individual. It also highlights the importance of the workforce. I wanted to touch briefly on the workforce. Under tremendous pressure, a lot of vacancies, and affecting people's actually well-being and mental health. It's an area I think that you're very passionate about.
Yes, I'm the mental health spokesperson for the Lib Dems, and I was a trustee of a mental health charity for a long time before I became an MP. And one thing we find is that professions, especially healthcare professions, really suffer with burnout, partly because they're not getting the support they need to do the job well. They're overstretched, they've got too many clients or too many patients, and you end up getting something called compassion fatigue because you are exhausted. You're either anxious or depressed or physically exhausted, and it means you don't have the time or the emotional capacity to give people the care they need. And someone said to me something, it's one of those little comments that sticks with you sometimes. And because my father had dementia, and we cared for him at home for a long time, and I was talking to someone else who was in a similar situation, and about their father went to hospital, and they said the staff, they were so busy because he received treatment but no care. And I thought, that's actually a really good phrase, isn't it?
That's interesting.
They were doing their job well. He got the right diagnosis, the right treatment, but they didn't feel he got any care. And that is something we need to really address. And a really good example in Winchester is that the local council recently were going to shut down an adult daycare centre, mainly older people with dementia. The key thing about this is unpaid carers who are often full-time, often elderly themselves, they drop off their partner and they get a day of respite, and they either just do jobs or chores or just have play around with golf or just do something for themselves. And we must have had several dozen people contact us over a 48-hour period saying, if this centre closes, I won't be able to care for this person at home, and they'll end up having to go into full-time care. And so actually, it would cost the council and the taxpayer more to have a whole load of people in full-time residential care, even though they think they're saving a little bit of money by shutting down, respite care, daycare centre.
And with a very tight fiscal envelope for this government, you made the point that actually there's a tremendous fiscal advantage. The Social Care Foundation's report is very candid, and it says that they will engage with any political party that has the realism and ambition to do so. Just a final quick point, Liberal Democrats' ambition for social care clearly top of the agenda.
Yeah, absolutely. I mean, for years we've been calling for cross-party talks on social care because we need a long-term plan that won't change as governments change. And you cannot kick this can down the road because, at the moment the NHS is really struggling. People are getting an aging population, lower birth rates. It's not something we can ignore. It's at crisis point already. So this report is very welcome.
Well, I think nobody will disagree with you from the sector. Thank you very much for taking time to join us on Voice of Care. We hope to see you again, perhaps talking about mental health.
Yeah, looking forward to it.
My pleasure. Thank you, Danny. Jane, lovely to see you. It's been quite a while since we've last spoken on Voices of Care. Welcome. The Social Care Foundation, I think you're part of the Advisory Council. It's been a hell of a year. Reports has come out, and wanted to get your views because this report doesn't really pull many punches. It's asking for radical and urgent reform, not waiting a few years.
That's right, because we really need it. In 25 years' time, 25% of us are going to be over 65, and we are sleepwalking into both a humanitarian and an economic disaster if we don't grasp this. And it's very disappointing that the government's 10-year health plan, which is very good, made very little mention or no real mention of social care. It's such a missed opportunity because working in neighbourhoods is the answer, and home care is so well placed to play a key role because the care workers are out there in the communities, visiting people multiple times a day. They're the eyes and the ears of our healthcare system. And if they can lock into the multidisciplinary neighbourhood teams, that helps the clinicians as well, and it enables conversations about improving outcomes for the individuals that everybody is supporting collectively.
Now, you're a national, deeply respected voice for the home care segment of the social care sector. And I wanted just to tarry there for a moment because home care, of course, is distinct. It has its pressures. And the report, I think, germane to that, has really asked for effectively a revolution in the way funds are distributed and in the way that commissioning takes place rather than a lottery based on price alone.
Yes, I think we can learn lessons from Australia. Australia is not perfect either, and the providers there at the moment have got concerns about some of the things that are happening. But one of the features of their system, which merits strong consideration by Baroness Casey, is that the funding is based on need. So they have a nationally recognised assessment tool. So wherever you live in Australia, you'll be assessed against the same criteria. And then a government subsidy associated with different levels of need. That in new legislation, they'll have 8 levels. And then that money is allocated. People don't physically get hold of it, but money is allocated to them, and then they can choose their provider. So there is genuine choice and control. Our Care Act 2014 talks about choice and control, but the reality of commissioning practice is that people don't really have it. The councils auction off care to the lowest bidder, and people have to like it or lump it often. So I think that would be a really key factor. Another feature of Australia is that they have fewer providers per unit of population, and our system seems to be struggling with the rapid growth in very small home care providers. So the Care Quality Commission has been unable to keep up. And
issue ratings.
Yes, so we've published a report today showing that 7 out of 10 home care providers currently either don't have a rating, so a third don't have a rating at all. They've never been rated. And the rest of the 70% have not had an inspection for 4 to 10 years. So there is no assurance for the public, really, about the safety and quality of services. And it also makes it difficult for local authorities and NHS bodies purchasing care, because they've got to decide whether to take a risk and use providers that have never been inspected, or to exclude providers that could be good, but they haven't got an up-to-date rating. So
Something to learn from internationally. Final questions. I know you have to get back to the report launch. Talking about the people, the workforce, the report calls for a 10-year workforce plan, perhaps building on skills for care. One aspect of that is that the social care system has been effectively propped up over the last 3 years by international workers. That is coming to an end de facto. How do we solve that? Because we need a lot more people to work in the sector.
I think that commissioning is the key to improving workforce issues in home care. One of the problems that we've got into is that councils have been buying care from multiple tiny providers and fragmenting the hours. I'm exaggerating to make a point, but some of them have got 200 or 300 providers and they're giving 3 hours each.
Yep.
It isn't quite that bad, but it means that each provider then doesn't have enough hours to create stable, solid jobs for people. And with the international recruits, they have to have full-time salaries. And that fragmentation of hours is at the root of a lot of the welfare issues, because the workers haven't got enough hours and they're not eligible to, they've got no recourse to public funds. So they're having to make ends meet doing cash in hand work.
That's a vicious cycle.
Yes. So I think also if there were fewer, better quality, and we're not talking about massive providers. In some places like Sheffield, for example, they've divided the city into 14 geographic zones, and they've put one home care provider in each zone, and each home care provider delivers about 2,000 hours. So we're not talking, 300 million turnover type operations. These are still local organisations, but when you've got all of the hours concentrated in a geographic area, you can organise the rotas more efficiently, and that supports the green agenda as well. And it makes the jobs better for the care workers, because they're not having to zigzag, travel lots, and only spend all their time travelling instead of doing what they actually love, which is improving lives.
Well, let's hope some of these recommendations, the report, is listened to by policymakers, Casey Commission. It's great to see you as always, and I think we're long overdue a lengthy chat around home care, because I know it's a very transformative moment for the home care sector in particular.
Brilliant. Thank you, Suhail.
Always a pleasure to spend time with you. Thank you, Jane. Lucinda, thank you very much for joining us. A seminal moment, a report from the Social Care Foundation. And I know that you're a scholar of Spanish, and the social care sector is sometimes a Sancho Panza to the Don Quixote of NHS, but one can't survive without the other.
Yeah, definitely. This is a really important time for social care. And as you're saying, we can't reform the NHS without fixing social care first. So in some ways, the current government is acting quite slowly on social care. It's obviously delayed action by introducing the Casey Commission, which won't have its final report till 2028. But next year, with the interim report, will be a really important moment. So we really need to galvanise the sector and get everyone on the same page in terms of what we want to take forward on reform.
And one of those key things, centre of the sector, is, of course, it's going to be its workforce. The report calls for a 10-year plan building on skills for care. You're also a migration scholar. Now, paint that picture for us, because the social care sector has fundamentally been reliant on international recruitment the last 3 years, about 240,000 people. That now has to change because of policy. How are we going to square that circle?
Yep, so you're right. After COVID, we really saw the impact of Brexit hitting the sector hard, with the workforce shrinking for the first time on record. And then the Conservative government therefore brought in the care worker visa route. But unfortunately, it just copy-pasted a visa route that was fit for the NHS. It really showed the lack of understanding in the Home Office and in the rest of government of the social care sector and the social care workforce. And there were significant problems with exploitation of staff and exploitation of the visa route. And therefore, they've slowly restricted it again. And then now, as you say, Labour government has come in and said we'll be transitioning to the end of a care worker visa route by 2028. In the meantime, it's really relying on the Fair Pay Agreement, which we're hoping will have some confirmation quite soon on funding. That seems to keep being delayed. But yeah, this is an important moment for the workforce too. The Health Foundation has long called for a more strategic approach to workforce planning in social care. Obviously, the NHS has its long-term workforce plan, and the Social Care Foundation is rightly calling for a long-term workforce plan alongside that for social care.
Absolutely. One final question, if I may, just stepping back a little bit. The Health Foundation, I'm a big fan. Read all your work that comes out. And one of the key recommendations from this report is that actually there has to be true integration between the NHS and social care. We've got integrated care boards which are going through their own metamorphosis at the moment. But paint a little bit of picture around the Health Foundation's work, because it's reporting a very significant increase in terms of the incidence of people with long-term conditions by 2040. That's something we can't wait for, and social care has to be centre of that.
Yeah, so in some ways it's a good news story. People are living longer with, as you say, long-term conditions. And that's a testament to innovation in our healthcare system and good support in the community. But we do need to think long-term. Our projections show that there will be proportionately far fewer working age people compared to the older population in the future. And so we do need to plan for the long term. And the Social Care Foundation is right to propose doing that.
Well, I look forward to hopefully welcoming you and the Health Foundation back onto Voices of Care. I'm really delighted that you come and shared some insights with us today at a really important moment for the Social Care Foundation and indeed the sector.
Good, thank you.
Stuart, welcome to Voices of Care. Thanks for making time on a very, very busy schedule, and belated congratulations on your appointment.
Well, thank you. Thank you very much. I mean, I'm under no illusion that it is an enormous task, but it is one that I really care passionately about, and I'm lucky to have a really good shadow team as well behind me. So there's a lot of work to do, but I am looking forward to doing it.
Now, you've come along and heard the speeches, the Social Care Foundation, very passionate around reform of social care. But we're and one of the key demands, of course, amongst many, is increased funding. But we've got a very tight envelope. I wanted to get your view on social care. Seems to have been put to the side, I think, by the present government, is the claim that we've heard today.
So, look, for me, social care is one of the big issues that I want us as a party to be thinking about. And but equally, it is where I want us to be constructive too, because I really feel that if we're going to sort out social care, because more and more of us are going to need it. I'm actually seeing it myself at the moment with my father.
Right.
And suddenly you are put into this very complex system that is quite difficult to manage. But if we're going to sort that out, we need to think about this in much more long-term processes than the usual 5-year parliamentary cycles. And so, we did have the cross-party talks this week with Baroness Casey. And I have to say, I was really encouraged by the attitude of all the political parties. Under no illusions that it's not, it's going to be a challenge, but at least there was the willingness at that meeting to have the conversation and see if we can find at least some common ground that each political party, whoever ends up being in government, can commit to sort of carrying forward. But the reason I'm here is because I want to listen. I'm engaging with all organisations and individuals that are involved in social care, because the policies that I want us as a party to develop, I want them to be based on evidence. I want them to be based on what experts have told us. I want to stress test them. But equally, and most importantly, I think probably, is how we implement them, because that's always the issue. Lots of solutions have come up in the past. Implementation has always been the challenge. And also, where are the opportunities for making this much easier than it is? And I think one of the interesting parts, there's lots of interesting ideas in there this morning, but I think one of the key things for both health and social care is the issue of technology. We are not using it in the way that we could. We're not integrated enough. Hospitals don't speak to GPs. Borders create problems. All of that needs to be resolved. And that's why one of the sort of working parties I'll be having is actually people who are tech savvy, because I'm not, and get people in who can give us advice and expertise about what could be done to make life a lot easier, particularly for the workforce. I think that's the frustration I hear from a lot of them is the amount of paperwork, how complex it is, difficult to get information. So that's certainly something I'm keen to look into.
And to facilitate that technology, which the report calls for a 10-year technology plan, as you said, Stuart, and there will be requirement for increased investment. And it's important that the report actually is encouraging policymakers to foster an environment, regulation and commission that helps the sector to be sustainable, to attract the investment from the private sector that's required.
Exactly. And these are all the big issues, big questions that we are going to be looking at as a party. We are in the middle of our policy renewal program. This is probably one of the biggest policy renewal programs we've ever done as a party for the last half a century. And, we're engaging with our members, but we're engaging with experts as well. And it has been fascinating. The thing is, there's like a deluge of ideas out there, and it's trying to bring it all together that is coherent and easy to understand. But I think there was another interesting point that was made in there, and that is about social care in the consciousness of the population. It is something you don't really think about until you're faced with it, and often you're faced with it suddenly. It's quite a challenge.
Absolutely.
You're not aware of it. I don't think people are really aware of the fact that you do have to pay for social care.
I think you're right.
I think people assume that it's all free, and it comes as a bit of a shock when you get to that moment where you are told you've got savings, you're going to have to pay for your care. So we also need a bit of a conversation about educating, and I don't mean that patronizingly, but educating the population that when you get older, you will have to pay for your care.
And that's going to require some political candor and courage.
Well, I thought what was really good about the cross-party meetings we had was Baroness Casey was talking about having that difficult conversation with the population. And I think there is a responsibility on all of us in political parties to encourage that to happen, because only when we have the honest conversation and the population are absolutely aware of what the situation is and where the challenges lie, can we then hopefully get them to understand that this is a major complex issue that will need addressing.
Well, I think more honesty in politics, no one's going to disagree with. I wish you well with the policy review, and I hope you'll come back and join us for a fuller discussion when you've got those policy recommendations, because I think, as you said earlier, all voices need to be heard, and people need to be able to accept that this is a challenge for everyone in society.
Indeed. Yes, well, I'll be delighted to, and thank you for having me.
It's been a real pleasure to meet you, Stuart. Thank you very much for your time.
Thank you.
I'm sure you agree it's been a really interesting opportunity to listen to a myriad of voices around social care reform. If you've enjoyed this episode of Voices of Care, please like, follow and subscribe wherever you receive your podcasts. And if you want to learn more about how we're turning the dial on health and social care reform, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you very much for joining us on this episode, and I look forward to seeing you next time. Thank you.
Voices of Care, the healthcare podcast.